You probably know aspirin as a headache remedy or something to protect your heart. But what if it could also help fight cancer? A 2024 review in Pharmacological Research pulled together decades of clinical research on aspirin's anti-cancer effects. Here's what they found. Studies show that daily low-dose aspirin may reduce the risk of colorectal cancer by about 13%, especially when taken for several years. In people with Lynch syndrome, a high-risk genetic condition, aspirin lowered cancer risk by as much as 60% over 20 years. The benefits aren't limited to the colon. Research suggests aspirin may also help with stomach, ovarian, prostate, and lung cancers. But here's the catch: it doesn't work for everyone. Age, genetics, and even sex may influence its effectiveness. And aspirin can cause bleeding in the stomach or gut, so it's not for everyone. The bottom line: aspirin shows real promise as a low-cost cancer prevention tool, but more research is needed before doctors recommend it broadly. Always talk to your doctor before starting daily aspirin.